Good afternoon. My name is Nicholas Anthony Garcia, and I will be your narrator for this presentation on managing mental health disorders and interventions and evaluations. The types of mental disorders that I'm going to talk about are anxiety disorders, bipolar and mood disorders, personality disorders, schizophrenia spectrum, disorders of adjustment, and trauma. First, we'll start off with anxiety disorders. The common medicine used to treat anxiety disorders is selective serotonin reuptake inhibitors and sertraline and venlafaxine. Other therapies may include benzodiazepines and beta blockers. The best choice for treating this disorder is cognitive behavioral therapy. Bipolar and mood disorders. The main medication for bipolar is lithium. It's the gold standard and it's often the first choice of practitioners. Alternative medicines are antipsychotics like quintiapine, dietary medications like antidepressants like flunexine, and alternative interventions like dialective behavioral therapy, DBT, can help with this disorder. Next, we have personality disorders. Primary medication is antidepressants. Additional medication can be antipsychotics like olanzapine, and also mood stabilizers can be used to treat this personality disorder like the motragine, and alternative interventions with ischemia therapy have been shown to be quite effective. Schizophrenia spectrum. First line for schizophrenia is antipsychotics, olanzapine and risperidone. Secondary treatment is antipsychotics and territory medications, collapsapine for treatment of schizophrenia have also been used quite effectively for the treatment of schizophrenia. Trauma and adjustment disorder. First line of medications are SSRIs, sertraline, flunexetine, and adjacent medications are benzodiazepines for short-term anxiety relief, and the third line of pharmaceuticals is antidepressants like trazodone for sleep. And the intervention that's going to be used to treat trauma and adjustment disorders is going to be EMDR, eye movement desensitization reprocessing. The NAWS ethical responsibility. Social workers shall have the ethical responsibility to promote public welfare and facilitate social participation and to work towards and advocate for systemic change regarding mental health. They need to help resolve problems around over medicating, pill mills, big pharma, which can hurt all of us. Through social and political action, social workers can challenge these practices and advocate for better model of treatment. Limitations of medicine for bipolar disorder. The risk of side effects can be weight gain, sedation, muscle twitches, etc. They can also relapse despite adherence to medications. Effectiveness can differ substantially from person to person. Medications do not treat the root issues of emotional regulation. Alternative to pharmacological treatment for bipolar disorder. Alternative medications, medications, and family therapies. We also must learn about mood cycles and triggers, and in the base of success to prevent and handling relapse. Benefits of learning to control your mind, including less dependence on drugs. Evaluation and practice in mental health. Assessing progress of treatment and modifying interventions. We also must treat with outcome measures to track symptom reduction. Pharmacological and non-pharmacological interventions. We must personalize interventions to the client's needs and respond accordingly. This concludes my presentation. Thank you and have a good evening.